Hi everyone! It's me, Janella. So for today's video, let's tackle about Madeleine Leininger's theory of culture, care, diversity, and universality. So first, before we go through, let's tackle about Madeleine. So who is Madeleine? Madeleine was born in Sutton, Nebraska, July 13, 1922. Daughter of German father and an Irish mother. Obtained diploma from St. Anthony's School of Nursing, Denver, Colorado in 1948. Madeleine obtained BS from St. Scholastica of Benedictine College, Atchison, Kansas in 1950. MS in Psychiatric and Mental Health Nursing from the Catholic University of America in Washington, D.C. in 1954. PhD in Social and Cultural Anthropology from University of Washington, Seattle in 1965.
What is transcultural nursing? A substantive area of study and practice focused on comparative cultural care, known as caring values, beliefs and practices of individuals or groups of similar or different cultures with the goal of providing culture-specific and universal nursing care practices in promoting health or well-being or to help people to face unfavorable human conditions, illness or death in culturally meaningful ways.
Here are the basic tenets of the theory. First, we have care, caring, culture, cultural care diversity, nursing, worldwide, cultural and social structure dimensions, health, cultural care presentation, cultural care accommodation, and last, cultural care repatterning.
Assumption of theory. Care, central focus of nursing, and the very essential job of the nurses. Caring, essential for health and well-being, healing, growth. Culture care, broad, holistic perspective to guide nursing care practices. Nursing's central purpose is to serve human beings in health, illness, and dying. There are similarities and differences in culture care. No cure without giving and receiving care. Awareness of folk remedies, influence influence of practices by cultural beliefs, practices, worldview, religious among others.
So since we are done with the assumption of nursing, let's proceed sa reason for the theory. So, Madeleine Leininger has four main reasons why she created this theory. So, the first reason is increased migration. The second is realizes patients of different cultures require different needs. Number three is culture shock at Children Guidance Center. And number four is doctoral work in cultural anthropology.
Goal of the theory: to provide cultural congruent care or care that fits the culture, and comprehensive approach in patient care, also consideration of cultural dynamics, patient involvement in her care, cultural congruent care, and should focus on patient values, beliefs, and practices.
Let's proceed to the culturally competent care. Incorporate client beliefs and practices into the plan of care, provides holistic cultural based care, integrate appropriate cultural practices into patient care, knowledgeable about cultural differences.
The Sunrise Model. So the Sunrise Model is a conceptual visual guide that depicts the interrelationship of culture care, diversity, and universality theory. It also illustrates the major components of Leininger's theory. The model is not the theory per se, it only depicts the factors influencing care. So these factors are needed to be included for culturally competent care, hence the Sunrise Model was created. The model is a valuable guide for doing cultural, logical healthcare assessments of clients' health needs. Integral part of the model and the theory include cultural care meanings and practices. Model structural level 1. Level 1 reflects the one's worldview on cultural and structural dimensions. Level 2, it represents the person with different parts, which include factors such as technological, religious, philosophical, kinship, sociocultural values, life phase political, legal, economic, and educational. It shows that person it shows that the person is a product of their culture. If the person is a product of their culture, that says that the person is influenced by their environment. Moving on to level 3. Level 3 represents the health. It provides information about folk and professional system. The folk health system include the client's traditional beliefs and practices on health, while the professional health system are those nursing practices learned cognitively through formal professional school of learning. The combination of the folk health system and the professional health system meets the biological, psychological, and cultural health needs of the patient and the client also in this level. The nurse acts as a bridge between the folk and the professional systems. Level 4 represents the nursing part. It depicts the three models of nursing care actions. The first mode is a cultural care preservation, wherein the nurse helps the client family preserve or maintain their health beliefs and values. The second mode is the cultural care accommodation, wherein the nurse negotiates with the client or the family for cultural congruent, safe, and effective care for their health well-being, or to deal with illness or dying. The third mode is the cultural care repatterning, which refers to the nurse's action and decisions that help the client in the family in restructuring or changing their lifestyles for new and different patterns that are culturally meaningful, satisfying, or supportive of a healthful life.
And lastly, we have conclusion. So, sa conclusion is culture affects nurse-patient interaction, which is true. Second is nurses should ask about client cultural practices and preferences when providing care. And number 3, integrate the client's cultural needs, beliefs, practices into the plan of care when necessary. Number 4, respect and recognize cultural diversity. Number 6, be more knowledgeable and sensitive with cultural diversity. And number 7, failure to congruent with clients' values, beliefs can lead to cultural conflicts, stress, non-compliance, ethical, moral concern. Bye!